Good morning and welcome to everyone joining us across WA for the webinar, Homelessness and Injury. Thank you for joining us today. I would like to acknowledge the Whadjuk Noongar people as the traditional custodians of the land on which I'm hosting this webinar today and pay my respects to the elders past, present and emerging. I would also like to acknowledge all other traditional custodians from the lands of those who are listening in today. Just some quick housekeeping before we get started. Can everyone please ensure their microphones are to mute? And we've also delegated some time at the end for questions. We would love to hear your questions, so we strongly encourage you to please send them through in the chat tab. We will go through the questions at the end of the presentations. Also, at the end of the presentation, when the webinar ends, a short survey will appear. Can you please provide your feedback on today's webinar via the survey that will pop up on your screen at the end. So a bit about Injury Matters. Injury Matters aims to prevent and reduce the impact of injury within the West Australian community. We promote the significance of injury prevention by providing education, advocacy and support for those affected by the impact of injury to create safer people and places. Today's webinar is brought to you through the No Injury program. No Injury is a statewide program which aims to enhance the capacity of injury prevention and safety promotion practitioners and organisations to deliver quality injury prevention activities. Through the Know, Learn, Connect approach, we provide training, resources and networking opportunities to increase knowledge and skills needed to prevent and reduce the impact of injury in Western Australia. We are providing this webinar today as we would like to increase the awareness of homelessness and injury and to support professionals to increase their knowledge in this area. Injury data for people experiencing homelessness can sometimes be challenging to find. However, we know that through information collected by the Royal Perth Hospital Homeless Team, that rates of comorbidities amongst patients seen by the homeless team was often significant, with 1 in 6 patients presenting at the hospital having a primary diagnosis of injury and 1 in 10 people having a secondary diagnosis of injury. Due to the interaction of individual and structural factors, the relationship between homelessness and health outcomes is complex. Individual drivers of homelessness include, but are not limited to, trauma and PTSD, mental health issues, substance use problems, poverty, domestic and family violence, and interactions with the justice system. And we will be hearing more about some of these topics from our speakers today. We have 2 guest speakers with us this morning who will be discussing the WA strategy to end homelessness and what the data tells us about the impact of injury and wellbeing of people experiencing homelessness. So our first guest speaker today is John Berger. John is the chair of the WA Alliance to End Homelessness. He has worked in leadership positions in the not-for-profits over the past 3 decades. It has been noted by many that his leadership and ecosystem thinking have allowed for completely new ways of approaching change in the field of homelessness in the West Australian context. John is passionate about ensuring the voice of lived experience is central to informing change. So I'd like to welcome John.
All right. Good morning. Happy to be here, or welcome. Look, I'm just going to, I guess, do a bit of an overview around the whole issue of homelessness, its presence within the West Australian community, and talk a little bit about how we're changing our approach. And then when Lisa speaks, she'll talk in more detail about some of the specific issues that we're going to cover today. So, homelessness in West Australia. So, I'd like to just do a bit of an overview. As you can see, homelessness takes many forms. Obviously, the most visible form is rough sleeping, but we also know that the homelessness count include people actually in supported accommodation, people couch surfing, living in marginal housing, and also, you know, I guess we know the phenomena of people now also, you know, living out of their cars, particularly in West Australia. There is also a bit of a definition around chronic homelessness, and it is the chronic homelessness that most of our information will be focused on them. They probably make up roughly around about 20% of the total cohort of homelessness. So if we look at Western Australia, the figures are about 9,000 people who are considered to be experiencing homelessness. And if you look at the specialist homelessness service providers, there were roughly 24,000 people who presented to specialist homelessness services in the last 12 months. But if we go more specifically, you'll see the breakdown of that 9,000. So out of that is 1,000 that are rough sleeping, which is interesting given the figures that have gone through the hospital system. About 1,000 in supported accommodation, nearly 2,000 staying temporarily with others, 1,000 in boarding houses and lodgings. And then the largest figure actually, which is a non-metropolitan figure predominantly, is people in severely overcrowded dwelling, and that's probably more representative of homelessness in the regional and remote areas where people are living, with often 15 or more adults sharing one house. There's the figure of 24,000 people. Some of the drivers is domestic violence, financial difficulties, housing stress. The most concerning figure is the 67. So we can't keep up with the demand. So on average, there are something like 67 inquiries per day that we cannot respond to. And you can see some figures around women and young people. Just quickly, obviously the determinants of homelessness. So there are individual determinants, there are structural determinants, and they come together to create a whole lot of risk factors. So anything from housing affordability, lack of employment, poverty, loss of identity, through to individual factors such as trauma through domestic violence or child abuse, alcohol and drug dependence, being in the child protection system. All these come together to create the various risk factors that can often lead to homelessness. So, being a CEO or having worked in this area for many, many years and having been the CEO of St. Bart's, I guess one of the things that particularly dawned on us is that, homelessness was not changing. Even if you look at the last two census data from 2011 to 2016, the same number of people experiencing homelessness has not changed. And those even at risk of homelessness, that the figure of about 7,000 has not changed either. So it really, I guess it really made us question, what are we doing, and how are we able to turn the tide on people's experience of homelessness? So there you see, there's a number of leaders, CEOs from various agencies across Perth came together, I guess, and said, so what would it take to end homelessness as opposed to responding or managing it? So part of the coming together is that we had to think about this in a different way. So we drew a little bit on systems design and systems thinking. And, when you look at a problem, often what you see is just what's like an iceberg, is what you see on top. It's actually what's underneath. That's actually the things that have to change. And particularly in any issue like homelessness, often we can spend a lot of time looking at structures, policies and services. But again, what we've really got to tackle are the mindsets and the narrative that sits behind an issue like homelessness. And even the notion of changing the narrative from responding to homelessness to ending homelessness is a huge shift. And so we took a leaf out of the whole sort of design approach to say, actually, what we've got to do is change some of the narrative and change the mindset. So it's all the bits that are underneath that are not visible that we have to tackle. So in 2017, a number of us came together to declare at the Social Impact Festival, which is usually held in July, to say that we will come together and we will seek to end homelessness, not just respond. So it was a very public declaration. Obviously, we need to think big, but we need to do it together. And to some extent, we're using this theory U approach where we, I guess, spend time looking through systems through different lenses, and I'll just quickly touch on that. So things like, what is the evidence telling us? What is the condition for change? What are the strategic connections? And how do we ensure that the voice of the lived experience is central to everything that we do? So going back a slide, so essentially what we did is we used the Social Impact Festival to bring together not the usual suspects, to bring a whole cross-section of the community to sort of say, so what is it that's going to end homelessness? And the way we did that is actually we cast our mind forward and said, in 50 years' time, if there was no homelessness in WA, what would that community, what would it look like? What would be different in our community around that whole idea of there was no homelessness? And so from that, we started to say, actually, yes, we need to start to look at, you know, our structures being very different. And we even had a banker get up and say, well, maybe the banks have got to stop looking at the Great Australian Dream of a 4x2. And that's the underlying things. They're the things that actually keep the system in its place and doesn't allow us to move on. So that's where we've got to really challenge. And it's an iterative process. So we're constantly reflecting and thinking, what are the things that we need to change? So having cast our minds forward, we looked at this idea, if in 10 years' time, homelessness looked different in this state, what would it look like? So for us, it was, you know, listening to the lived experience, is that no individual or family would stay in emergency shelter or sleep outside for longer than 1 week, and they would be moving into safe, decent, affordable housing. Now that's huge, because at the moment there are some people who have been homeless for decades, and you know, and as we will talk about some of the chronic homelessness, so that's a huge shift. But part of the plan was to say, these are the things that need to change. These are the things we need to start to shift or turn the dial on the system so that we are moving towards this sort of outcome. So we spent 18 months after that Impact Festival trying to, I guess, develop a sort of a 10-year strategy. So what are the things that need to change and shift over the next 10 years that will help us achieve some of these targets? And we also knew that homelessness across the state will be very different. So what's relevant in the Kimberley certainly won't be relevant in the Great Southern, nor will it be relevant in the Perth metro area. So the idea of developing this strategy is it's a framework. It's a framework that people can adopt and work within, but obviously adapt to their individual circumstances. So just quickly, obviously housing is key. People need access to affordable housing. I'll talk about it a little bit more, but we have a housing system that is very skewed and doesn't deliver small, safe and affordable housing for the demand out there in the community. Prevention. So one of the key aspects that we need to tackle is how do we ensure that people are not exiting into homelessness? So whether they're coming out of the prison system, coming out of child protection, coming out of our hospitals, we know that many people go straight into homelessness. So we need to be able to tackle that. Obviously the system, the service system needs to be strong and coordinated. We need to ensure that any person whose circumstances suggest that they'd be at risk of homelessness can be picked up in any setting, whether it's with their GP, whether it's with a counsellor, whether it's with the social service, or whether it's with Centrelink. We need to know that that circumstance is arising, and as a system we need to be able to respond. Data and research, obviously we need to know what are the dials that we're trying to turn. So, you know, how long are people's experience of homelessness for that matter, and use that data to then say, well, what do we need to do to improve? So we want to be evidence informed. So one of the key fundamentals is to ensure that we have good data. And then obviously, last but not least, but probably the most critical bit, is building the capacity of the community, because people live in communities, and it's the community that actually can see and respond in the first way. And we also need to ensure that the voice of and the narrative around homelessness is a realistic one and not based on myths. And so it's very important to engage at a whole of community level. So achieving the vision, well, the system is big and complex, and there are many aspects of it. Government have a role to play, but so does the community. So, we often talk about this whole notion of an ecosystem of solutions, that there is no one silver bullet. There is no one single approach that will end homelessness. Homelessness will end because we've actually been able to turn the dial on the whole system. And so that's critical. But to achieve that, we need alignment. We need to know that whether it's government, whether it's business, whether it's not-for-profit, whether it's the general community, that we're all trying to tackle this issue in an aligned way. Because much of the complexity of the system as it stands at the moment is that there are so many people doing so many things in so many different ways that the collective will is not being harnessed. And so if there's one thing that I talk about most, is the whole need around alignment. Obviously, I spoke about the voice of lived experience. So critical to everything that we're doing is to ensure that either young people or people experiencing homelessness are central to everything that we do. And they are, their stories are very compelling. And I've not been at an event where there hasn't been a lived experience shared, where the audience has started to shift its attitudes and shift its understanding around the issue of homelessness. Where if you go to the Alliance website, you'll see there's lots of materials and lots of resources available. So again, it's a framework. We encourage anyone to adopt that framework, and we also encourage people to adopt the learnings and the tools that we have, which is all freely available. And so we've developed a co-design toolkit, which is about bringing together both the voice of lived experience, but also service providers and interested parties to come and look at our response. And we would encourage anyone in any community to use these sorts of approaches. We hold what's called pulse meetings, which are meetings that are open to anyone. If you register at the End Homelessness website, you'll see all the information, you'll get invitations to these meetings. But that's not to say that if you live in the Kimberley and you're wanting to come together, you would do something similar. You would hold regular meetings to bring people together to look at how do we move forward? How do we tackle the issues that are faced by people within those communities? Just quickly, we have an outcomes and measurement evaluation framework, which has been developed by UWA. Again, that will be freely available. Our hope is that as communities start to look at homelessness in their own area, they would feed into this, and then we would start to develop a far more accurate picture of the impact of homelessness across the West Australian community. So just quickly, one of the things that I've mentioned is that we want to use evidence. Evidence worldwide and internationally and nationally says that actually the best way to tackle homelessness is to ensure that someone's got a safe and a secure and affordable home. That is the first and most critical ingredient. So, and that is not what we do at the moment. We have what we call the staircase model, which is you come in at a crisis, you may go to a specialist service, whether it's mental health or drug and alcohol. You may then move into a transitional housing setup, and then eventually, if you're lucky, move into some sort of permanent accommodation. Now, we know that the success rate for that is around 40%, which is not very high. And even if you make it all the way through that system, there is no guarantee that you stay in long-term housing. Now, the housing first approach basically bypasses all of that and says, we will put you into a home, but we will also provide the support that you need, because it's on the foundation of that house and the security of being in a home that you can start to tackle all the other issues that you need to tackle within your life. And the success rate internationally for the Housing First approach is 80 to 90%. So it's quite compelling. And even more compelling is that often the most effective way is also the most cheapest way of supporting people. So at the moment, I guess the community may not fully appreciate or understand that actually the current system of homelessness is very expensive. And as you can see, hospitalisation and emergency rooms are very expensive, but also, you know, being in prison or being in transitional accommodation does not come cheaply. So Housing First, this is drawn from evidence from America, is that Housing First, to be done successfully, to provide the support and the housing, is still far more cost effective. So it's a very compelling case around that. One of the other things that we're going to encourage communities to do is to adopt what they call the zero approach. In America, it's called Built for Zero. It's basically ensuring that anyone experiencing homelessness is known. So they talk about what they call a by name list, so that the service system, in fact, has information and shares information on anyone who is present or homeless within our defined community. Is an approach that's being used nationally, and we're just about to launch or move towards that approach here in Perth, across the Perth metropolitan area. The strength of this approach is that, one, again, it gives you accurate data of who's actually experiencing homelessness, and anyone who appears on the street can be picked up very quickly, and they don't have to repeat their story because, in fact, information about that individual is already known. It's very much a person-centred approach, so that the response is very much individualised to the person concerned. It's also looking at what can we do to continue to improve our responses, because as we see people come into homelessness, what is it taking to get them into the housing, and what is it the support that they need? And if they're coming back into homelessness, what is it that we're failing to do as a system? And it also acts as a way of bringing people and parties together. Now in Perth, we've got the 50-50, 50 Lives, 50 Homes project that's been running for almost 3 years. They've housed over 200 people. These are the most vulnerable people who have experienced long-term chronic homelessness. Their success rate is over 80% because they provide the in-home support to those individuals. I'm not going to spend a lot more time on this. I'm just going to skip over a few bits. The zero approach requires a commitment of services to come together. It's a coordinated approach. It's an active list of people by name. We continue to map people's progress. We prioritise people for housing according to their need. And we obviously analyse the effectiveness of the system. So this is the model. So the by name list, how it works essentially is you keep track of the inflow. So who's coming into homelessness, who's actually experiencing homelessness, and then who's actually going out. And the idea is that eventually the outflow becomes greater than the inflow, and so that you're starting to reduce homelessness. So in America, one of the examples they use is ending veteran homelessness. So as you can see there, from January, you had 16 people coming in and so many people in homelessness, and only the outflow was quite low. And then as you see over the period of months, the inflow starts to reduce and the number of people actually accessing housing actually increases. So the idea is that, in fact, you are housing more people than people coming into homelessness. The other big issue that we know about is the issue of housing and housing need in Western Australia. So as I mentioned earlier, the social housing is the area that we have the shortfall. There is just a complete lack of social housing. The social housing is made up of 44,000 homes, which is about 4% of the total housing market, and it is in decline. It's actually reducing. and not everyone is able to move into, you know, the open rental market and or housing market, particularly when they're coming out of homelessness. So yeah, so this is the continuum. You know, those in moderate incomes or in long-term private rental or home ownership, the housing market is reasonably well catered for there. It's the those on very low incomes that we have a real crisis. There's a whole lot of levers that we can use to impact on affordable housing, particularly from a local government role, but also looking at, you know, our tax laws and the way we structure and incentivise housing. A lot of that is missing. That's why there is a call for a national strategy on homelessness, because we need, you know, the federal government to incentivise more housing or low-cost housing. Look, I'm not going to cover this too much, because what I'm going to do is I'm going to hand over to Lisa to talk to her bits, and then we'll talk about some of the local responses or the local options.
It'd be funny if I had an injury.
Thank you, John. That was really informative. So our second guest speaker today is Dr. Lisa Wood. Lisa is a tireless advocate for research being relevant and useful to the real world and the need for academia to translate into a practical setting. Lisa's research and teaching roles at UWA are complemented by nearly 3 decades of experience in public health and health promotion in WA, nationally and internationally. This experience includes work with academia, government and non-government organisations, as well as engagement with the public health as a public health consultant. Since completing her PhD in 2006, Lisa has been involved in a range of research relating to the social determinants of health, with a strong focus on reducing health inequalities experienced by vulnerable population groups. Lisa currently holds a teaching and research position within the School of Population and Global Health, and is also a Senior Research Fellow with the Centre for Social Impact. So we'd like to welcome Lisa.
Thanks, Glenda, and good morning, everyone. So as you picked up from Glenda's intro, I actually have a long history in public health. In fact, injury is quite close to my heart, because my very first job in the health department was in the health promotion area, and it was the first time they were trying to do a campaign around binge drinking in young people, and we went in with the kind of rationale around violence, which seemed to be a bit radical at the time, because you were meant to just be talking about alcohol and its health effects, and we were going, but the violence is the health effect. So anyway, injury and homelessness. So I thought I'd just start a little bit with some we talk a lot in Australia, and I'm really passionate and involved in work around closing the gap in Aboriginal life expectancy, which is a terrible gap. But even more disturbing is when you look at the life expectancy gaps for people who are homeless. So you can see the average 47 years in several large UK studies. And then for homeless healthcare recently, we had data on date of death for 134 patients who had passed away. The average age of death was only 46 years, and 2/3 of those people were younger than me, and I don't regard myself as old. So it was pretty heartbreaking to see that. And I think even though we know that Aboriginal people are overrepresented in the homeless population in WA, even if you accounted for that, these stats are terrible. Other data from overseas saying that mortality rates, which includes things from injury, 10 times higher than the general population. And I think when I was in the UK recently for an international conference on homelessness, one of the papers that had just been released was showing that 1 in 3 deaths, at least, and they thought that was conservative, are actually treatable or preventable. So they're the kind of things that most of us are not going to die of, but people who are homeless will. So lots of, basically, you think of any kind of health issue and the data would say that people who are homeless are overrepresented in that, whether it's physical, mental health, disease. We have a big issue in WA and elsewhere with mental health and drug and alcohol issues coexisting. And one of the problems in here is, and elsewhere, is that people just literally ping pong between the two systems. So I was talking to a policeman last night about how if they take someone into the hospital and they're convinced they've got mental health and drug and alcohol issues, they have to sober them up or sedate them. Some places won't take them in because they'll say you've got to be clean before we'll see you. This is a massive issue in terms of accommodation options. So when John's talking about the options, and I guess in the injury world, harm minimisation is the concept that people get. And in the UK, they had some wet shelters, so places where they recognise that people will continue to drink, but they can do it in a safer environment. Whereas here, there's people out in the street at the moment because there's no place that will take them, and yet there's no supports for them to give up their addiction. So they're stuck between a rock and a hard place. And we know that when we look at why is it that people who are homeless have such terrible health, there's a whole lot of things. I mean, just the basic competing needs, you know, you're surviving on the street. Often they've had really bad experiences of the health system before, really high levels of trauma. So it's not that great being in an emergency department with bright lights and loud noises at the best of time and ambos coming in and out. So you can imagine if you are really sensitive to that. Just the practical issues of getting access to you know, to a doctor, to medical care, stigma. I think a lot of evidence, and when John talks about the voice of lived experience, is just how people feel they've been treated by the health system. So one lady I interviewed said that she finally plucked up the courage to talk to the doctor about her drug use and self-harming, and he didn't look up from the computer. He was typing his notes, and for her that just devastated her, and she didn't. It was another 2 years before she went and sought help. And I put up, this is kind of our classic social determinants of health model, which we trot out whether I've been working in tobacco or drug and alcohol. You know, we see it's the same things. And when we went to say, well, would we adapt this for our work around homelessness in our team? Not really, because it's the same social determinants that drive inequities in health are there for homelessness, and they're the same social determinants that drive inequities related to injury as well. And I guess the key thing in terms of today's audience is that nearly all of the major determinants are actually outside of the influence of the health sector, and a lot of them outside the influence of the homelessness sector. And I guess that's that broad call to action that John's talking about. So one of my favourite quotes from Andrew Davies, who we work with a lot at Homeless Healthcare, is about really the futility of patching people up in the hospital and then discharging them back to the street. And as part of that work, we've seen, you know, some terrible stories. One man was in a wheelchair. He'd been homeless for 20 years. The hospital notes said that they gave him a taxi voucher to go back to the bridge where he was sleeping. I mean, it's just hopeless. And so you can see I've just put one of the case studies there because John alluded to the cost of demonstrating the need to that prevention is cheaper than a cure effectively. So this is one patient. I was actually in a ward round with Homeless Healthcare and the homeless team when I saw this. So you know, his diabetes was out of control. They couldn't really stabilise it. Mobility issues. He had a learning deficit as well. Possible schizophrenia hadn't really been sorted out. The medical record said use insulin 4 times a day to store it in a fridge and sleep in the street for goodness sake. So just hopeless. And you can just see there when we costed up his hospital use just in the last year or so, it's a huge cost to the system compared to what it would cost to house someone like that. So there are those stats that Glenda put up earlier. And it's interesting when we do a lot of work with the hospital data, because you've got injury is quite a broad category. So even self-harming comes under injury and poisoning. And then when you start to look at the subcategories, you know, there's the whole range from motor vehicle assault, but certainly lots of types of injury are more prevalent amongst people who are homeless, and that's because of the vulnerability of where they're sleeping, the environments they live in. So I wanted to talk about a bit about the kind of different pathways that injury and homelessness relate. So firstly is to say that, because it's kind of a bi-directional relationship. So this is an example of someone where injury was the pathway into homelessness. So Steve, we've called him, mid-20s, so everything's real except for his name, got an ABI. So then as a consequence, he's had cognitive impairment, issues managing his finances, mental health issues. So then that's led to arcing up issues with his accommodation, using alcohol to self-manage his depression, something along there. Then he's been in unstable housing, so it's even more. So that you can just see the whole thing escalates. Then he's going to ED, then he's in contact with police, ongoing mental health issues. So, and this is not uncommon. The rates of acquired brain injury amongst people with homes are really, really high, and often have preceded their homelessness, which is on this slide here. It's estimated about half the people who are homeless have a brain injury. In the 50 Lives, 50 Homes evaluation that we lead, about half of those self-reported brain injury, and 70% it's estimated before homelessness, but also a lot of it once they are homeless, and particularly that's that vulnerability to assault. And it's easy to think, well, that's just if you're sleeping on the street, but actually if you're living in a backpackers, or you're trying to sleep with all your worldly goods around you, you're much more vulnerable to those things. And that we know from a health point of view, but also from a sustaining your tendency point of view, is that if you've got a brain injury, it impairs your cognitive processes around compliance with health treatments, navigating the paperwork to get into social housing, paying your bills, a whole lot of things that these people are literally kind of set up to fail. And I'll talk a bit later about the supports we need for that. And so I think in terms of across the state, an issue is how vulnerable people are to injury just by virtue of trying to find somewhere safe to sleep at night. And this is data from around 1,400 people who've done a VI SPDAT survey at some point in Perth. So these are rough sleepers. Because we often have that stereotype that people are sleeping in a doorway or on a bench, but you can kind of see up there, there's bushland, and I know the local government area that I live in, there's a couple of patches where people are sleeping in the bush, a lot of people sleeping in their car, as John talked about. So we get a whole range, caves, so if you live in a community where there's a cave, that's where people might be. And I've got a great story about the psychiatrist who's now working with homeless healthcare. There's a client who has a lot of social anxiety issues. So he said, well, I'll just go visit him in the cave as part of his treatment. And that's kind of about how we have to change the paradigm as well, what John is talking about. It's not about a psychiatrist in a white coat sitting there saying, come and get my service. He's going, well, I'm no white coat and I'm going to climb into the cave and talk to him because he won't come out. So the other thing is that, so we've got injury can lead to homelessness. Injury can also complicate the sustaining of tendency. And I think a big part of when we talk about ending homelessness is about the house is not the endpoint, because a lot of people are going to need extra support. So this is another man that I've met as part of our evaluation. He ran his own business. He became homeless after an ABI again. So then he wasn't attending his follow-up appointments. He didn't have a lot of social support. He got housed, but he was a bit paranoid about taking his medication. He would forget to take his medication. And so when I went and visited him, he'd had a mental health OT come out, and she'd talked him through about where to leave notes to remind himself. So there was a note stuck to his milk saying to take his medication. Otherwise, he was having seizures and going back to the hospital. So it's really complicated for some of these people. But when John talks about the success rate of keeping people housed for 50 lives, that's part of it. There's this after-hours team of a nurse and a caseworker who go out when people need them. And it makes a difference between them going back to hospital or not, or surviving or not. You can really see I did some of my slides late at night, 12 months. So this is about clients who, for the 50 Lives evaluation, we've been looking at, we now have police data as well as health data, and that's been really fascinating in a kind of sobering way. And so what we saw for a cohort of 50 Lives, 50 Homes clients, 38% of them had been victims of assault, and that compares to about 2.4% of the general population. And a lot of that has occurred while they've been homeless. Some of that includes FTD, but also other forms of assault. And sadly, and I think one of the most shocking results we found in that data was that once people were housed, for some people, being a victim of crime actually increased. And at first that seemed counterintuitive and not what we'd hoped to see. But I was talking to a senior policeman and he said, well, it makes sense because they now have an address where they could be found if they've got like an abusive partner. They've got property to steal. they've got a place where other people come and say, I need a bed for the night. And of course, if they've been homeless yourself and then someone says, I've got nowhere to stay, so these are some of the things that I think we have to think about beyond housing people. What do we need to be doing to prevent injury and other ramifications? But I was talking to my colleague, Dr. Amanda Stafford at Royal Perth, also about injury and homelessness, and she said, you should include an example of how injury can actually be the pathway to get out of homelessness, which I hadn't really thought of. And so she said they've seen some people on the ward as part of the homeless team where the injury, it's such a visible health effect. So they can have other things, they could be dying of prostate cancer or bowel cancer because they've never been screened. Lots of things might be invisible, but the injury actually is often visible and forces the presentation to hospital. And so she said that can really be the opportunity to help someone. So this was a guy who had lost his job, living in his car. He'd been in a motor vehicle accident and lost the car, so therefore lost his home in effect. And there was an issue about where was he going to stay, how was he going to rehabilitate from his injury with nowhere to go. And so they supported him to get into some low-cost accommodation. So in an ironic way, the injury was kind of the thing that if he hadn't injured himself, he could potentially still be in his car. So I kind of wanted to talk about a few things that we can do, partly injury-related, but also more broadly. I'm very conscious that we've got an audience from around the state and people in local government and different organisations. So I think, firstly, that preventing an endless homelessness is an upstream form of injury prevention. So just as in any other area of health promotion now, we're thinking about who are the groups where there's the greatest inequality. So people who are homeless is one of them. I think many of the evidence-based strategies to reduce homelessness lie outside both homelessness and health sectors. And these are the things that unless we address these also, we're not really going to turn off the tap. So I visited Finland recently, and there's a lot of talk about how Finland has virtually ended homelessness. And they've done amazing work, and their housing first has been really successful. But talking to people there, they said, we haven't ended it because we haven't ended family and domestic violence, we haven't ended poverty, we haven't ended addiction. And it was a really salient reminder that these things have to be part of the solution, and they lie with sectors and not-for-profit and government agencies. So an example that we've been evaluating a program, Safe as Houses, which is preventing homelessness amongst women who've been affected by family and domestic violence, and it continues to horrify me, just the high rates of homelessness driven by family and domestic violence. So unless we're going to make greater inroads in this, it's going to be really hard to reduce it. And it also has got implications for where we house people, the supports we provide afterwards. So we've had some great changes to the tenancy laws recently, and that's already benefiting some of these women who now can change the lock if their ex-partner finds out where they are. But, this is a massive issue that, everywhere can be dealing with it. And I know my own local government, City of Stirling, has a refuge, which I didn't even know about, but it's about, and it's one of the refuges where you can go if you've got teenage boys. So a lot of refuges don't take women if they've got older children. So where are they meant to go? What can we do? I think the domino effect of homelessness, of wider policy and economic decisions, we can't anticipate it. So when I was in the UK, a lot of talk about how the austerity cuts in the UK have really driven a rise in homelessness. They're seeing a massive spike again in rough sleeping, emergency departments, and we're seeing it also in Western Australia, I think, as well, particularly with the lack of affordable housing, and as John said, the type of housing that people need. So we know that a lot of the people on the 50 Lives, 50 Homes waiting list who've been there for quite some time is because they need something, one bedroom, ground floor, because they have mobility issues, and there's just not many places like that. So this was a quote from the policeman I was speaking to last night, Sergeant, not right, but his observation down from the Fremantle area, he said, it seems to be on the rise that all the services are overwhelmed. Police, the hospital, the drug and alcohol services, the community agencies. And it was a really powerful point. He said, when the services that help prevent homelessness and the services that deal with it are so stretched, there's a domino effect. And so that kind of has a place for all of us in terms of our advocacy for other services and advocacy against cuts. What else can we do? I think I have to, a lot of stuff is the Alliance is to be commended for its efforts to consult around the state. to recognise that homelessness is a statewide issue. But unfortunately, a lot of the attention and the data comes from the city, and we would love to see, you know, that changing. And so I know everyone thinks I'm going to say that because I'm a researcher, but good data does help. So, you know, for each area, knowing, you know, who is homeless and where are they. So when I was in Albany recently, launching their public health plan, and I was asking people about homelessness, they said, well, we have it, but they didn't really have they don't know the stats, they don't know the size of it. They know that people are coming into the emergency department. And where are the places that people are sleeping or going in your local community? Coming back to injury, I think this was from a question in the VI spit out that says to people, what do you need to feel safe and well? And you can see there with a lot of this is not a graded question, and it's really basic. It's back to that basic level of Maslow's hierarchy, what people are wanting, but often their response is around safety for them, for their children, you know, just a roof over their head. And it's really kind of heartbreaking to read some of these. And I think this is my last slide, but also to think, you know, to think about some of the things that perhaps when John talks about changing the paradigm, some of the things that we've been doing in the past, or the things that are happening, how they seen by the people who are homeless, who are living it. And so we've had a lot of attention, unfortunately, in the Perth CBD around some of the comments of the former Lord Mayor and moving people on, David Jones, etc. And this was a quote from one of the 50 Lives clients saying, we're just trying to get out of the rain, you know, we're not bothering anyone, and they just keep moving us and moving us. And the big question is, where are they meant to move on to? And I think finally just saying that part of what we've got to do is get beyond the silos, and so that, which was a big point of what John was talking about, that cooperation. And I know both through some of the outreach work that Uniting Care West and others are doing, and Homeless Healthcare now is working a lot with rangers and police on the ground in Fremantle and in Perth too, because it's those kind of services that are out there at the coalface that know where people are, they know where they can find them, they see people at risk, they see someone with an injury sleeping slumped in a corner or whatever it is, and the more we can join up those things, and that's where that by name list that John's talking about is going to be really fantastic, because people can enter data and say we've seen that person there, or can we get them, or the hospital can't find someone because they've gone AWOL, and they can kind of track them down, and that's really going to be really powerful. So I guess to sum up and then hand back to John and some questions is just to say that homelessness is a whole community and whole government across all portfolios issue. That injury is both a driver and a consequence. And really the big thing for me, a lot of our attention now is about, I think particularly for injury and mental health issues, the lasting effect of those and the implications it has for how we support people once they are housed, so tenancy support services. And really that kind of prevention, which has been always a key theme in injury anyway, but that's what I kind of love about my public health history now coming into homelessness, is that the public health model of prevention and early intervention and upstream is, it's kind of been a no-brainer in health, and I think it's really where we have to head for homelessness as well.
That was very informative. Thank you, Lisa. We do have a few questions. So one just come through for you in particular, Lisa, is around, are you collecting stats from other services that can speak into the model of reducing homelessness?
We do have, it's a mixed answer. So we kind of are doing, a lot of our research is unfunded or pro bono. So we do the evaluation of 50 Lives, 50 Homes, which picks up data from some other organisations. We have police, health, some domestic violence data. But yeah, I think that's, to me, and I know John flags that as part of the whole ending homelessness strategy, good data is really important. And I think having it for across the range of services is really powerful. And so I'm kind of really, I guess, part of the agenda, my agenda from a research point of view, is that the more we can bring in data and statistics from other sectors, and also use, we've learnt the hard way how messy some of this data is, because homeless people, it's not neat. That often they change. I spent the weekend trying to work out why we had 3 people with a similar Medicare number. It's because they've changed name, they've changed gender. It's really messy, and I think there's some learnings we've got that might be helpful for other places wanting to kind of collect some local data.
Just to add to that, I guess in terms of the evaluation framework, we're also trying to collect some of the systems data. So, you know, what are the numbers of social housing and what's the demand for that in our community, you know, for affordable rental. So, you know, for instance, my daughter recently applied for an NRAS property, which is supposed to be an affordable person on a low income, and there were 70 applications for that one place. So, you know, the demand is huge. So we need to understand where is the housing demand, what sort of housing do we need, and then how do we change the system to ensure that there is a supply of housing required. So, so it's both individual, but also at a systems level.
Yeah, yeah, thank you for that. There's also another question around what are the possible strategies or solutions to help change people's perceptions of homelessness at a community level?
Well, I think the key to this is the narrative. So we have to challenge some of the underlying narrative within the community. And the most effective way to that is hear the stories and promote the voice of lived experience. So there is a project through Shelter WA at the moment where I think it's about 10 people with lived experience are being supported and trained in being able to share their story and talk in the media and speak publicly. One of the biggest challenges is that often as they share their story, they often feel the trauma again. And so, you know, it is a challenge for people to be able to process not only their own trauma, but then to be able to share their story in a safe way and in a supported way. So, but that's definitely the most compelling way of changing the community narrative. I think the other thing is we need to challenge some of the myths out there. Actually, anyone can live in a home as long as they get the right support. A lot of people have this perception that people who are homeless can't, you know, live in a home. Well, that's not the case. They can. And 50-50 is a good example of how some of the most vulnerable and the most people who are most chronic homeless are actually successfully being housed.
Yeah, with that support.
Yep.
I think this was touched on a little bit, but the question was around, is homelessness still a rising issue? Do you feel it's on an increase or remain fairly steady with as it's difficult?
Well, as Lisa said, some of the drivers for homelessness being around, you know, family and domestic violence, poverty, you know, that hasn't changed. And so people will experience challenges in their life and that may impact on their housing. You know, the interesting thing is in WA between the two census, the figures have not turned, as in they are the same numbers from 2011 to 2016. Although from a statistical perspective, because the population has grown in Western Australia, someone suggested that homelessness had changed, but it's still the same number of people still experiencing homelessness. That has not changed.
But increased in most other states, I think, in the census.
Yeah, it has changed. It has increased in most other states. And there are cohorts that are emerging. Older people, for instance, is one of the fastest growing cohorts experiencing homelessness. And so, you know, we need to look at, well, what's driving that and what do we need to do to change? So unfortunately, homelessness is not declining. And if you go to Finland, where, you know, they have turned the dial, homelessness has dropped in proportion to the number of social housing that they've provided. So as social housing has increased, so has homelessness decreased.
Yeah, I've seen the outcomes from that. And then someone else has asked, what can I do to help people who are experiencing homelessness?
You know, conversation does not hurt. You know, I mean, that's not to say that if they do see someone on the street, that, you know, that they necessarily, you know, just a simple hello, how are you going? Is there anything I can do for you? Through to advocating for systems change, talking to your local politician and saying, why is there not enough funding to respond to this issue? You know, why is it that we allow people to continue to experience homelessness? Even from a you know, sort of taxpayer perspective, it costs more to respond the way we are responding than to actually house people. So, you know, to advocate for change, get involved in a local agency, volunteer your time. You know, there are many things. Get on our website and register at the endhomelessnesswa.com and register your support. So, yeah.
Great. Is there any more questions, Angela?
Someone asked, what are the major taps we need to turn off that lead to homelessness?
So that question was, what are some of the major taps we need to turn off to end homelessness?
Do you want to?
Well, I'd definitely say family domestic violence. And I was just reading on Twitter this morning, there was someone who talking about a woman who had left a really abusive relationship with 2 young children, applied for parenting payments through Centrelink, and still hasn't got her payments after 3 months, so she's going back. It's an abusive relationship. So it's really complicated. So you've got a combination of a systems driver, you know, and the current federal government has made it much harder for people to access things like Centrelink payments, robo-debt and all those things, coupled with family domestic violence. So I think that's one of the main ones. And I think we do have, unfortunately in Australia, we have a widening gap between the haves and have-nots, and we know from all the evidence overseas and from here that it's health inequality and that gap that is the biggest. And that's one of the reasons why those Scandinavian countries, their health is good, because it's a much more level playing field. They still have people who are a bit richer and a bit poorer, but it's not as extreme as here. And I think that that is an issue here, and almost in some of the data we see, it's almost like people who are homeless are not even on the gradient. It's kind of like they're not an underclass. That sounds terrible, but it's just that they're so out of sight and out of mind, except for when they're sleeping, you know, getting pulled over by police. But it's just like their stats are so terrible. It's almost like they're not even in that kind of, when we talk about people below the poverty line, they're not even near the poverty line, you know. So yeah, I would say poverty and family domestic violence are the 2 main ones for me, and the housing, I guess.
I guess the other big driver is people exiting services, so government services like prisons, hospitals, you know, child protection system. You know, that they are all overrepresented. If you look at the trajectory of people leaving those institutions, they all almost step straight into homelessness. So we need to turn the tap off on that, and we need to turn the tap on socially and affordable housing. You know, that is a tap that has been turned off, and it's now time to open it up again.
Yep. Great, thank you. I think that's all of the questions for today, but there's definitely lots of good take-home messages from the presentations from John and Lisa. I think some of the standouts for me were the importance of good system design, so we'd need to be looking at structures, policy and beliefs around homelessness. Also the importance of listening to the lived experience is really valuable as well. And as Lisa touched on, the social complexities around homelessness and how they link to safety and injury prevention, and that we all need to be working together to address everything across a really broad level to have an impact